All right, well, here we go. Hello and welcome everyone to the August 2021 installment of the California Urgent Care Association's monthly town hall meetings. These monthly meetings are put on by the California Urgent Care Association. They're completely free of charge to anyone, whether you're a member or not, anyone that's interested in learning more about running urgent cares, the legislative environment, all things healthcare and specifically urgent care related. My name is Claudio Varga, and I will be your host for today's meeting. I am the Director of Operations at Vital Urgent Care located in sunny Newport Beach, California. I am also a member of the Board of Directors of the California Urgent Care Association. Today's presentation is a real treat. We have Mr. Craig Cottrell, Director of Field Sales for Medline Industries, and I'm going to get right back to him in 1 second. First, we're going to do a couple of quick little housekeeping things. It is getting close to election time for the California Urgent Care Association Board of Directors. So for members, we invite you, if you or someone you know in your organization is interested in throwing their hat in the ring and perhaps participating on the Board of Directors, then please do so right away. Shoot us an email at info@caluca.org. That's info@caluca.org, and just indicate your interest in being nominated. And the deadline is the middle of next week. I'm going to say Wednesday. So don't hesitate, get those nominations in as quickly as possible, please. And then the other housekeeping, we will have this presentation and there will be time for questions and answer at the end of the session. So please submit your questions via the chat function down at the bottom. And at the conclusion of the presentation, I will read those questions off to Craig and he will have plenty of time to answer those in depth. So without further ado, I'd like to introduce Mr. Craig Cottrell from Medline Industries, and it's all yours, Craig.
I appreciate the warm introduction, and it's a pleasure to have the opportunity to speak to you all today. Today, our main conversation is going to be talking about how supply chain excellence can elevate patient care and profitability for urgent care centers. Just going to do a quick little agenda here of what we're going to be discussing today. For those of you who don't know, I do work for Medline. I'm going to do a little bit of information about myself and Medline. I'm going to talk about how we're finding that urgent cares successfully navigate this recent Delta surge, and what the allocation outlook is going to look like, hopefully here in the next 2 to 3 months. We're going to talk about the benefits of working directly with a manufacturer and what that can do for an urgent care facility. We're also going to touch on how to limit your cost per patient served. We're going to talk about formulary and logistical impacts that you guys can have by implementing at your clinics. We're also going to talk about patient retention, and then also about maximizing the value of a laboratory that you could set up in-house within your urgent care. So a little bit about myself. This picture is about 5 years old and 35 pounds ago, but quarantine hasn't been super friendly to me. But I've worked at Medline for about 4 years now. I started off as a sales rep in downtown Seattle, moved to our corporate accounts team about a year in, and since then I've kind of been promoted to our director of field sales, and I oversee our urgent care vertical that has 3 specific urgent care directors dedicated to doing nothing but calling on urgent care locations. I also do the same for our community health vertical. I also manage a logistics team that really goes into the nitty-gritty in terms of how to better provide supply chain excellence to urgent cares and non-acute clinics. And I also manage our analytics team and all the data behind it. Prior to the pandemic, it's been a little quiet as of late, but actually for the past 2 months, I have been on the road. I was traveling to urgent cares every single week, meeting with their C-suite, learning about what they do, learning about their challenges, and learning really how to better serve them. And Medline is a national company. I am based out of Tacoma, Washington. So for those of you who don't know about Medline, I'm just going to do a couple quick slides about Medline, who we are, what we do, and why we do it. We were started back in the early 1900s. We were a butcher manufacturer, and back in the early wartime, hospitals came to Medline asking us to create surgical gowns. And that's where we realistically started in the healthcare industry. Medline was the one that created that greenish surgical gown that everyone sees in the OR suites. to help ease the eye fatigue for surgeons. And, that was our start into the healthcare industry, and we never looked back since. Just a little bit about the company performance. In 2007, we did about 2.9 billion in sales. Here we are in 2020, and in 2021, it's actually trending closer to 20 billion. But last year we did about 17.5 billion in medical supply sales. It's important to point out that this isn't necessarily pharmaceuticals. If you look at some of our main competitors, they're heavy in the pharmaceutical space. Those are very expensive products that drive up the annual revenue. This is mostly in medical surgical supplies. What makes Medline a little bit special and a little bit different than everyone else in the industry? We are the only ones who serve the entire continuum of care. We've got product divisions and sales forces built out to serve everyone from the physician office space all the way to the hospital, and then all the way to the post-acute facilities. So we like to say it's diaper to diaper service. What's really important in regards to this is we're seeing that hospitals continue to acquire facilities all throughout the continuum of care to try and own the life cycle of a patient. And when one of the biggest things that hospitals are focused on is, really focusing on the quality of care that's provided, they can ensure that the same products are touching their patients, whether it's in the acute care setting, the physician office setting, or the nursing home setting. They know that the quality of care is still consistent. What's another really important part to think about is technically an urgent care can function very similar to a standalone ER. And a standalone ER has a lot of different functionalities in it, and Medline owns about 40% of that marketplace. So we kind of made the realization about 4 years ago that it was really important to take all the expertise that we've learned in the ER and translate that down into the urgent care setting. And we found many people really benefited from that transition. So we have over 300,000 different products. We manufacture about half of them. Here's just a couple key product categories where Medline is actually the #1 manufacturer of items. You'll see some pretty sensitive topics on there like exam gloves, textiles, traditional wound care, protective apparel. Medline is actually the #1 manufacturer of those items as well in the marketplace. We've got a global manufacturing footprint. We do have about 20 plus manufacturing facilities located in the United States or North America, and we do have a bunch of them overseas as well. But during the pandemic, it really came to light that owning the actual manufacturing process and the distribution process really led to a lot of benefit for our customers, especially when products and things got really tight. Also, distribution centers, we've got about 45 of them located in the continental US. Extremely important to be able to provide great service in terms of actually distributing the product and the amount of inventory your warehouses hold. Medline is a privately held company, unlike most of our competitors that are publicly held companies. The big difference in that is we carry 2+ months of inventory on hand for our customers. We deep dive into their usage and make sure that in our warehouses, we have 2+ months of their scheduled usage in our warehouse. During the pandemic and when the pandemic first hit, that really gave us a little bit of breathing room to figure out allocation and how we were going to best provide for our customers. It really was a game changer and paid extreme dividends, especially for our customers when COVID really had its first onslaught. Here's a quick map of all of our distribution centers. As you can see, they're scattered all throughout the country. Lastly, we do own our own transportation fleet. We got about 1,200 different trucks that distribute to hospitals, surgery centers, physician office, post-acute facilities throughout the country. We're rapidly expanding this fleet and adding new parcel services daily. It's a great personal touch, and our logistics team does a great job. And then finally, just a little credibility in terms of how Medline plays in the urgent care space. These are some of our strategic partners. A couple of big ones on the West Coast is like Providence Express Care, but here's a couple of pretty large names of companies that have partnered with us and look to us for solutions in terms of urgent care. So now I'm going to kind of jump into some of the main topics that we wanted to discuss in this presentation. And the first thing is, over the past couple of months, it looked like COVID was dying down, and all of a sudden we've seen a pretty large surge with the Delta variant And what does that mean for you and your practices when it comes to allocation, the supply chain? What products do you see being dangerous? What products do you see being healthy on stock? And what does the outlook look like? And being a manufacturer, we do have pretty good insight into that. So one of the things that I'll start with is gloves. I know gloves have been probably a pain point for everybody at some point during the pandemic. You saw boxes of gloves that would typically go from somewhere between $7 to $10, in some circumstances be up to almost $50 a box. And then the supply just was not there. The demand far exceeded it. We are seeing right now, based off the input from our factories, the demand, and what's being shipped overseas, um, gloves are improving. Stock is here. Medline has removed gloves from allocation. So we're seeing a very healthy rebound in terms of glove inventory across the country. Same with PPE. Masks are healthy, N95s are healthy, gowns are getting a lot healthier. There was been a big push to increase manufacturing capacities. And for this second wave of COVID, inventory is definitely healthier than what we've seen in the past. Same thing goes with masks. With that said, we are seeing new challenges in the marketplace. And a lot of those new challenges are strictly around ports and shipping. It's become very difficult to get product from overseas to the US. A lot of the times because we don't have any product in the US to send back overseas. So shipping costs have become astronomical and the movement of the containers has become very difficult. One of the things that we're seeing is on allocation right now and could potentially be troubling over the next months are certain DME products. One of those being crutches, probably a commonly item purchased by urgent cares. The other thing that I would caution you guys is I know a lot of urgent cares are in rapid growth mode, continuing to open up new facilities. Capital lead times have drastically increased. Many of the parts of their of capital equipment are sourced from overseas, and depending on certain regions and how hard they were hit by COVID, certain factories have been shut down and lead times have increased. So if you're looking to do new build times, definitely make sure that or if you're looking to do new builds, make sure you give yourself a significant amount of lead time because some items that typically may have been able to be sourced in 4 to 6 weeks are now up to 10 to 12 weeks, which when you've got a set practice opening date could technically delay a clinic opening. One of the things that we did at Medline, and I'm sure many other vendors in the industry have done, were spot buys. I still see those to continue to be a thing throughout this new pandemic with excess volume of gowns, gloves, and masks being brought into the country to really help protect against the Delta virus or the Delta surge. And then also from a respiratory standpoint, we're seeing a lot of O2 sensors, things like that. That stock is very, very healthy. So that's a very encouraging sign compared to when COVID had first set in. Like I had mentioned before, allocation on gloves is drastically increasing. We've actually taken allocation off. So if that's one of the products that you're concerned about here in the near future, I think you can have a little bit of breathing room. It is not going to get as bad as it was, let's just say 12 months ago. The last thing that I want to talk about is on the exam glove portion is pricing. We are seeing that the pricing of exam gloves over the past 18 months has just totally taken off. Raw costs have increased. The manufacturers started jacking up their price. And at the end of the day, it became a bidding war, and where even Medline in certain circumstances was bidding against countries from some additional manufacturing capacity at facilities. And what we're seeing now is that price is starting to drastically decrease. We're trying to do our best job to lower our costs as our costs lower. But I would suggest right now, if you did stockpile gloves during the pandemic, burn those off, because over the next couple months, if you burn off the inventory that you have, there is going to be inventory at your vendor. And that price should drastically decrease over the next couple months. So in terms of the financial awareness of what you're spending on gloves and what your inventory costs, I would suggest if you do have a large stockpile of gloves, start burning those off because the cost of gloves is going to drastically decrease over the next couple months. That's what we see in our forecast. So, how does working with a manufacturer impact your urgent care? What does that mean? What differences do you get from it? And how does it impact your bottom line? The first thing is controlling your costs is key. And working with a manufacturer allows you to get direct pricing. And if they're a good manufacturer, they're going to pass on that savings directly to you. The other thing that we're noticing is pretty cool and urgent cares are taking advantage of is customized solutions. Suture removal kits, as an example. There's a lot of stock suture removal kits, but if your manufacturer can customize one that eliminates items in that kit that you're not using, it will decrease your cost, increase your efficiency, and have a positive impact to your bottom line. Also, we're finding that being able to label and customize your DME products to be able to put your label, your urgent care's label on a brace that you're giving to a patient, or an ankle brace, or a walking boot, or a crutch, or a wheelchair. Having the ability to brand and customize is another great way to separate you from the competition and also get your name out there. The other important thing about working with a manufacturer is the GPO eligibility portion. Manufacturers are able to be on GPO contract. Private label products are not. What's the important part of being on a GPO contract? You know what your cost for that product is, and you can go to that vendor and find out, what are you charging me to pick, pack, and deliver that item? That is how hospital systems buy. They know their contract cost and they know what their vendor is charging them to pick, pack, and deliver that item. Being able to align your items to GPO contracts will give you transparency in terms of your costing. And then finally, this is probably the most relevant portion, especially with the recent pandemic. Working with a manufacturer, you're going to get better insight into the supply chain. You're going to be able to have good visibility as to what's your inventory level like, what do you have coming from the factory into your warehouses, and hopefully that will in return get you a better visibility and better numbers in terms of the allocation that your company needs. One of the things that I've seen in a lot of my travels and meeting with urgent cares is there's a big extreme focus on controlling your cost per patient. Right now, urgent cares are really feeling their margin at risk. There's a shifting model for insurance companies to pay less. There's consumerism where individuals, especially those terrible millennials, I unfortunately happen to be one of them, are always on their phone looking for a better option, looking for a quicker option. And it's really tough to get that brand loyalty. On top of that, reimbursements are dropping, operating costs are increasing, staff is stretched extremely thin, and that's never been more relevant now during COVID. And at the end of the day, your guys' bottom line is continuing to be squeezed and your margin is at risk. So one of the ways that you can really focus on being able to protect that margin to stay viable is to know and understand what is your cost per patient served, and what does that look like from a supply standpoint. What materials am I using on a patient per average? If I do this procedure, what is my baseline cost of actually servicing that from a supply standpoint? And it's really important to know as you continue to expand your practice and offer new services within your practice. So one of the things that we like to really do is identify the products that are used on a patient. How often are you using the supplies, and what metrics do you have in place to be able to really quantify that number? Do you have a formulary in place to make sure that you're touching the same patients with the same products every single time, no matter what facility of yours they walk into? And then also, lab testing could drastically increase your cost per patient served. Some of the individual reagents can be very expensive. I'm sure every single one of you could probably know exactly how much a COVID-19 individual test costs today. And I'm sure over the past 6 months, you've seen that cost drastically decrease. But for a while there, every time you were seeing a COVID patient, there was a cost per test of somewhere between $20 to $35. And that's an expensive fixed cost that you would have per patient that you saw. The other important thing is ensuring that all of your locations, if you have multiple urgent cares, are paying the same price for the same products. Depending on how widespread you are, you may not be paying the same price at every single one of your locations, and that could be an issue. We're also seeing a lot of interest from urgent cares who are trying to disseminate whether certain procedures or certain lab testing makes sense based on, do they have a mix of private pay patients or do they have a mix of global fee patients? We're finding that the private pay patients are more willing, or the practices that see a lot of private pay patients are more willing to invest in lab testing and different CPT codes that they can bill for revenue, where the global fee patients are looking to be able to provide a high quality of care, but to limit that cost per patient to make sure that they're not spending too much on supplies where they end up on the opposite side of what that global fee is. It's also really important to know your cost per patient, because as you scale, you really need to know exactly what your numbers are in terms of your cost per patient that walks in the door. It will help you budget and it will help you be successful long term. We're seeing a large amount of private equity investments in the urgent care space, and private equity loves to understand these numbers, so it's great to know. It also really helps too, because as you continue to scale, you can leverage your size to lower your cost per patient, to get better tiers with your GPOs, and to lower the cost on some of the private label product that you purchase. One of the other big things that I'm noticing in the urgent care space is there is a heavy emphasis on formularies and also logistical improvements that people are making to better improve the efficiencies of how their urgent care operates. Formulary management is extremely important, and urgent care should not purchase more than 300 to 600 items on their formulary. Right now, some of our larger urgent cares have under 300 items that their clinics are allowed to purchase to provide care to patients. And really what that allows them to do is to standardize the products and standardize the quality of care that they provide across all of their locations. It also helps them ensure consistency in terms of their patient outcomes, because they know their providers are using the same products on the same patients, which will in turn create the same end result. The other big portion about a formulary control is it really helps your vendor partner manage the stock and inventory that they need to keep in their warehouses to be able to make sure that you always have the product that you need. It's also really important when you're creating a formulary to make sure that you're aligning those formulary items to the items that are on your GPO contract. That's going to ensure price transparency and also price stability. GPO contracted items very rarely change in cost, and when you do, you get very early notification on it. So making sure that as much of your formulary is aligned to a GPO contract as possible will be very financially advantageous for urgent care owners. The last thing that I'll touch on is really knowing your inventory levels and making sure that you guys have a par management system in place, making sure that every single one of your supply rooms is organized. We're making sure that every single one of your exam room has the same items located in the same place, no matter which exam room they walk into. And if you do this correctly, it'll really allow you to limit the amount of inventory that you have to carry. In return, lowering your fixed cost of what you have on your balance sheet at any given time in terms of supplies. One of the companies that Medline has partnered with, and there's also many other companies out there, is Hybrant. I'm just going to share some of the capabilities that Hybrant has. There are other companies that do this in the industry, and I would highly suggest, if you own an urgent care with multiple locations, that you look into some sort of technology solution that could help you improve your inventory management and in return lower your expenses and align you to the proper contracts. So a system like Hybrant is basically an Amazon portal where you can upload all of your vendors into one location: your med surg, your pharmacy, your vaccines, your office supplies, you name it, it can be loaded into this. And it gives all of your orderers one simple location to buy all the things that you need. And the nice part is you can make sure that all of those items loaded into Hybrant are on the proper contract, the proper price. It integrates into your accounting system. It does three-way invoice matching. You can set approvals. It gives you one location to pull all your data for all your spend. And at the end of the day, it really functions as if an employee would who would be dedicated to inventory management. The nice part about Hybrant, it doesn't have a health insurance plan, it doesn't have a workers' comp plan. And if you are working with certain vendors, it can be completely subsidized by that vendor. And overall, it provides a very large financial value, but it doesn't cost you what you think it does. So if you are a multiple location urgent care, I would highly suggest looking at a technology solution that can help you with your inventory management. During COVID, it was very, very clear that many practices were not ready from an inventory management standpoint to handle the gigantic influx of patients that they had to see. And then also in return, having the supplies needed to be able to see those patients. There were a lot of external factors that were out of their control, but it was also very difficult to understand based on identifying their usage. How much inventory do you really have to have on hand? Technology solutions in the marketplace can help you with that today. So one of the other big things that people like to talk about is patient retention. It's very clear right now that the urgent care space has a lot of competition. I was living in downtown Seattle before we moved to Tacoma, and I lived, right about here on the map. And when I walked outside my block, I had a Kaiser urgent care, I had a Swedish urgent care, I had a multi-care urgent care, and I had a Zoom care urgent care in about a punt of a football away. And I can tell you this right now, I can't punt a football very far. So you name it, you walked outside your door and you had all of these options. How do I separate myself from the competition? How do I ensure patient retention? And what have I seen in some of the meetings that I've taken with some urgent cares in regards to what they're doing to be able to capture the life cycle of that patient? So one of the things that I'm seeing is an expansion of lab testing if it makes sense. So one of the things that we're seeing be a big draw is same day office results, more testing capabilities. People hate waiting. To be able to walk into an office and get the result in 15 minutes while you're still with that patient is very, very, very powerful. And hopefully will then build some loyalty for that patient, knowing that if they walk into your facility while they are there, they do not have to come back and they do not have to be contacted again. They will get results there. Another thing that we're seeing is a lot of urgent cares are pivoting to offer primary care services. Having primary care services built into their office, really what that's helping them do is build a cadence with their customer base and also really help them with brand loyalty. Anytime that a patient would need care, having that primary care service really just allows them to always think, I can go to my urgent care for this. We are seeing in some circumstances a lot of specialty services being offered at urgent cares. People are starting to dip their toes into pediatrics and women's health to really be able to control the life cycle of that patient and again build their brand loyalty with their consumer base. The last thing, and I'm sure many of you on this call have participated in this, is telehealth. With COVID, this has become extremely relevant. If done correctly, it can be profitable, and it's also very easy to pivot to. Many of the urgent care practices that I've been into, when their nurses were not seeing patients, they were in the back doing telehealth visits. So they're really able to maximize the revenue that they can generate from the staff that they have. The last point that I wanted to touch on today is maximizing the value of a laboratory. I know urgent cares have heard a ton about lab testing. They've been on the front lines of COVID testing, but there's a lot of things that you can do outside of COVID testing that can drastically increase your revenue. Right now, there's a big debate for a lot of urgent cares of whether do I stay CLIA waived or do I make the jump to moderately complex? What does that mean to me from a financial standpoint? What does it do to my test menu? And just most importantly, does it make any sense to actually do this? We're finding that in most circumstances, it does. So one of the main things that I like to consider And anytime that I talk to customers who are trying to decide whether or not they should invest in a lab, is lab can be very quantifiable. So if you are currently sending out all of your blood work to, let's just say, a Quest Diagnostics or a LabCorp, you can have access to that data, and your vendor partner should be able to do a complete return on investment in terms of the tests that you're sending out, what it would cost you to do them in-house, and what revenue you would get based on your patient base in terms of reimbursement. It's extremely important to know, and your vendor should be able to easily provide you a very realistic return on investment based on the current tests that you're sending out today and what they would look like if you did them in-house. Having these return on investments done make it so much easier as a business owner or decision maker at an urgent care to decide whether or not a jump from CLIA to moderately complex makes sense, or whether to bring in a piccolo or an additional analyzer to do new testing in-house. I can tell you right now that there is a very good benefit to molecular technology. It has greater accuracy, greater specificity and sensitivity. For those of you who are doing strep testing, I know that's very common in urgent cares. Not having to send it out for confirmation, certain analyzers allow you the ability to not have to send out for confirmation. That drastically increases the time that it takes to confirm that it is strep. And it also then makes it even more difficult to chase down that patient after the fact to inform them that they do indeed have strep. Antibiotic stewardship and not just prescribing antibiotics when you don't necessarily need to. And it also just reduces the risks to have to bring that patient back. There's also here's a sample of what a return on investment would look like if you were continuing to do a rapid flow versus molecular. As you can see, it's slightly more profitable from a strep standpoint to do it on a molecular analyzer, but it's not drastically more profitable to do it on a molecular analyzer. Flu, though, that's a different story. When you look at making the transition from a rapid flu test to a molecular flu test, they're based on your patient base. And if you have private pay patients, you have the opportunity to, one, provide them a better test, and two, the opportunity to drastically increase your margins by doing a molecular test. And here's a specific example of a urgent care down in Texas that we work with, where we laid it out very clearly what the financial reward would be for them based on their patient base and payer mix of what impact would it have on your practice if you move to molecular. Like we had said before, there's a ton of competition in the marketplace. And one of the ways that we're finding urgent cares are differentiating themselves is offering a lab test menu to their customers. Some of the top tests that we currently see in urgent cares: flu, strep, RSV, urinalysis, STD testing. We're seeing a lot of drug and occupation testing, along with pregnancy and now more than ever, COVID testing. But some of the additional tests that you could consider that technically have a great return are CBCs, hemoglobin A1C, blood glucose, lipids, complete metabolic panels, mono testing, HIV testing, and sexual health testing. Very common and very relevant in a lot of the populations that you guys all serve. So what does it mean to you? What's your marketing message? Can you market a full testing lab menu? The answer is yes, you can. And to some of the millennials who do their research online, having a lab menu in terms of what your urgent care offers can be very impactful. And the best part, same day, immediate results. And if you're doing PCR testing, it can be extremely accurate. So with that, I'm going to kind of wrap up here and open it up to any questions, concerns, comments. Would love to have your feedback, and I'll stop sharing my screen here and open it back up to you, Claudio.
Hey, super job, Craig. Thank you so much. That was really, really interesting. I know a couple. We have a couple lab reps or supply reps that come around, and And on some days I just get on a roll and I just start beating them up. I have so many questions. Now I'm one of those people. It's like, how does this work? Like, why am I doing the right thing? I mean, tell me something. So I have a couple questions for you that I think you'll be able to answer. So with this COVID craziness, this last year and a half, getting who's got this test and what can we do and what can we not do? What's a send out? Does I have a machine? Can I get a machine? Can I get the machine, but I can't get the test? I got test, you know what I mean? All that stuff. With this EUA stuff, from your perspective, from your side of the industry, how does this EUA, how does that work in terms of, am I picking the right thing? Am I doing the right thing? I get these emails from, some guy in New Jersey who says he's got this thing and he's got a whole bunch of them and they're dirt cheap. But I'm waiting for my vendors and they're like, well, no, we're waiting on approval or this or that. How did that all come about?
Well, I can tell you this. We've seen a lot of companies be very opportunistic in this marketplace, where they are sourcing tests from China, things that aren't technically approved in the United States, and they're looking to make a quick buck. Personally, I know they're probably tend to be more expensive, but sticking with your large brand name manufacturers allows you to get that quality, consistency, and specificity that you really want for your patients to be able to get accurate results. We're going to see a lot of this in the marketplace continue with, new companies popping up saying, I got the latest and greatest, cheapest test. But without that EUA certification or just, the ability to really have the proof behind what they're actually selling you guys, I would just say be very cautious. In the hospital space, acute care customers went out and acquired a lot of different product from, I would call, sketchy sources throughout the pandemic. And many of them got burned for large, significant amounts of money. So I think, the safest thing is definitely do your homework. Definitely go to a vendor that you trust, even just to vet, even if you're not looking to purchase something from them. Hopefully they've built that partnership with you where you can at least seek advice from them, even if you're not going to be buying it through them. But I think the biggest thing that I would say, Claudio, is always proceed with caution, because there are a lot of people being very opportunistic in the marketplace right now.
Sure. I fielded calls from, just folks that I know, and they were picking my brain or they were telling me about the latest and greatest. And I can't find that anywhere, with any reputable, I'm like, it sounds too good to be true, and maybe it is. But so what about liability or exposure for some of these folks that did something? Say I do order a bushel from, Roger in New Jersey, and he ships a bunch of stuff over UPS. I mean, what it is my neck hanging out there, or
I think it depends. It depends on, the patient's reaction, the patient's satisfaction.
Sure.
Especially some of the millennials, everyone tends to be a little sue happy. And we've seen, we've noticed that even some of our current urgent care customers that, let's just say, due to supply chain, had to pivot to a new COVID test. And, their friends had gone the week prior to get a COVID test at the same location. And like, what do you mean? Why aren't you doing a PCR test? Why are you doing a rapid reader on a BD Veritor? And so the market has educated themselves on what they're getting, because there has been a lot of concern of like, okay, well, how accurate really is this test? It doesn't help when, Elon Musk, 8 months ago had sent out a tweet that said, I just took 2 tests. One was positive, one was negative on the same analyzer. Someone explain this to me. So the marketplace and the patients in the marketplace have become a little bit weary, and they've educated themselves. So it's definitely, there's liability there, but I think we're just still so early on that we don't really know what the true financial consequences are going to be.
Yeah, definitely. And just for the record, I've only ever purchased some stuff through our national, national, vendors. That's it. That's it. PPE. I did jump on Amazon a couple of times, eBay a couple of times. I'm like, you got gowns, I'll take them. That sort of thing. But any kind of medication, lab work, and stuff like that. Obviously not. But so you mentioned on something on managing fast growth, which we kind of saw that with COVID, just like this explosion. But so this is kind of 2-part. So what's your strategy, or what advice do you give someone opening a brand new urgent care and they're like, I don't know, I have to buy 100 of everything that I can think of. Or they put, Peggy Sue in charge and she just goes online and just starts, I've seen this where people they just buy stuff that 10 years later they've never even used. So what kind of advice do you give for people to prudently open another center, stock it with stuff? Just what's your advice with that?
Yeah, I think twofold. One, anytime you're opening up a new practice, time is your best friend. So if you can budget to have 6 months to know the location, how many exam rooms, what services we're going to be offering from them, having time on your side is huge. If you are trying to open a practice in 30 days and you're under a time crunch, things become much more difficult. And especially today with the supply chain and the international manufacturing constraints, you could be set up for disaster if you don't have time on your side. The second thing is I would ask you to really heavily rely on your vendor partners that are helping you outfit these clinics. We have the research and we have the data of when you open a clinic, how much inventory do you need to have on hand? How much inventory do you want to keep on your PAR based on what your expected patient volume is? And at the end of the day, you can spend a lot of money outfitting a clinic, and yet what you're actually doing is outlining a budget for 6 months of operating costs when realistically you only need 2 months of operating costs in terms of the actual supplies that you're putting in that facility. So I would definitely suggest you to reach out to your vendor partners and ask, what are you seeing in the industry in terms of opening up the clinic? How much inventory do they keep on hand? How are they stocking their exam rooms? And all those little things. And at the end of the day, it can lead to a significant cost reduction as you open these new facilities. And, as we all know, it's great to have as much cash saved up as you possibly can while you're fighting the pandemic, because the next COVID surge comes and, you might have to outlay several $1,000s for tests just to get through a week. And we've seen it on many urgent cares where their typical spend prior to the pandemic was $200,000-300,000, but yet over the course of 2020 they did $5 million with us because COVID testing, and that can really wreak havoc on an urgent cares budget.
Sure. So absolutely, I couldn't agree with you. And just the past can be a pretty good indicator of the future. I mean, I think with a good vendor where you can provide the spreadsheets with all the things that you've ordered over the past, literally you can go back sometimes a couple of years and boil it down to, and eliminate redundancies, because I see a lot of things are you 2-3 versions of maybe the same thing and you're not using one and it's expiring. And I think sometimes looking at that history, you can see that these ones should not continue, kind of making a roster or an inventory like a master. What recommendations do you have for just a simple, easy way of managing inventory in an urgent care? I mean, we're all busy. We've got people, we've got employees to train, and sometimes you just, it's something you want to get really real type A on it. And then you start this big project with spreadsheets and all this kind of stuff. And you get so exhausted just doing it, and nobody ever does it, right?
It is exhausting. And, all of our larger key strategic partnerships with urgent care are utilizing some form of technology in order to assist them with their inventory management levels. There's a lot of great solutions in the marketplace, and a lot of them can be subsidized by your vendor where the actual urgent care is not paying for them. I know that's something that Medline has leveraged. Selfishly, we've leveraged that with a lot of our key customers because we do have a solution where we can absorb the cost for it. And these technology solutions really give you great insight, and it also protects you during staff turnover. Because that's the other thing. When you just give someone open access to a website and say, hey, I need needles and syringes, or hey, I need this, hey, I need that, there's the potential to order the wrong things, no consistency. And these technology solutions really give you a framework to understand exactly what are my PAR levels, how much inventory do I have on hand, how much did I pay for that inventory, and when am I going to need to reorder that inventory. So there's a lot of really great solutions, and most of them are technology based. I think we're seeing some great things in the marketplace, and I think in the next couple of years, we're going to see some even better ones. So it's something to look forward to. And, at the end of the day, these technology solutions honestly can replace a full-time position that's manually doing this inventory. And there's a lot of value to that. more so now than ever with all these spikes and increases in patient volumes.
Yeah, definitely. I think that might be a situation where you don't want to have to be the expert on everything. It's like, just delegate it, find a vendor. They've done it a million times before. Just put something in place. I mean, there's barcode scanners and there's automatic ordering of inventory and things like that. And I know firsthand, there's some things that would be good candidates for that. DME is a good example where maybe you can, there's not so many of them, but they're expensive per piece, and it's easy enough to, it's a very small volume. It's not like needles and syringes. You only need a dozen of these or a dozen of those, and it's a little bit easier to manage. And you've got a little threshold, like in this, like dispense meds or something, you've got a little threshold. Well, we're down to the last 5, automatically kicks out an order or something like that, right? Like the Amazon, right? Auto order, auto monthly, something like that, right?
Bingo. And that's where I'd say you really got to rely on your vendor to, your vendor should have your usage as to what volumes you are purchasing. And they should be able to tell you, okay, you've had a spike in November, December, and in January. So we need to, your inventory levels can adjust there. But also knowing, based on the inventory that I carry, how much does that inventory cost me? And if I can get it next day, why would I be spending at the upfront early part of the month my full cost over the month, where I can sparse that out based on my patient volumes? And if I have a slow month, I didn't spend that extra 10 grand of supplies without having to need it.
That's a really good point. Yeah, that's a really good point.
I think,
in terms of cash flow.
leverage the data that you have at your fingertips, because at the end of the day, that's a variable expense that can sometimes get out of control, especially if there's not a monitoring piece or some sort of vice in place to say, hey, listen, realistically, this is what our practice needs to operate efficiently and no more.
Super. Absolutely. Absolutely. We've got, looks like we have time for one more question. So I've got a question here. Does Medline sell COVID rapid testing machines? I'm sure you do, and their test kits. And sometimes you can find one, but not the other. Take a minute and tell us a little bit about what Medline's doing in terms of, I'm assuming this is all on the rapids, CLIA waived and things like that, specifically speaking to the COVID crunch that we're in right now.
Yes, we do sell all the tests. I will say right now, some of these manufacturers are very short on product. They looked at the last 3 months and they saw COVID testing start to dissipate, and they scaled back their manufacturing efforts. They also are starting to gear up for a flu season. Many of these manufacturers are making the COVID tests on the same line that they make their flu tests. So, the industry, when they say wasn't prepared, I mean, no one, if you're Abbott, Quidel, Cepheid, or one of these ones, they didn't know COVID was coming before us. They had to pivot very, very quickly. With that said, we do have supply on the Quidel. I know we do have some supply on the Cepheid. I know on the Abbott ID Now portion, that's probably their most common COVID test. Their supply is getting a little tight, also with their BioNext Rapid Reader as well. But we do have inventory in branches, and one of the main things that we have been doing is really doing everything we can to take care of our current customer base. They've had the major spikes where we had some people buying thousands of tests, and then all of a sudden it was nothing for months, and now they're like, oh my God, I need more COVID tests, and it's right back to that same ramp. So we're really doing our best to take care of our current customer base. But yes, we do have extra inventory of some certain things, and we're happy to help. At any point in time, I would encourage you to reach out to me or your local rep, or whoever you can contact at Medline. We're happy to help. The main thing right now is making sure that providers and clinicians are protected, and that patients can get an answer as to whether or not they have COVID or not, so they can prevent the spread. We're not looking to monetize this. We are looking to really just make sure that all of your communities stay safe, and all of your people stay safe as well. So please do not hesitate. Yeah, please do not hesitate to reach out. Where we can help, we will help.
Yeah, super. So on that note, so Craig, how can people have follow-up questions and things like that? Where do they find you? How can they get in touch with you?
That is a great question. And I was looking at this presentation, and I realized I didn't put my email or contact information up there. So Claudio, if you don't mind, if I send you my contact information, is that something that could be disseminated out to the members who are the folks?
Sure, of course. Yeah, we'll do a follow-up for sure. We'll send out a little email blast to everybody as a follow-up, just to let them know if they have additional questions. So Definitely, definitely. So super. Craig, thank you so much for taking the time out of your busy schedule. I know it's crazy, and we really appreciate you sharing all this information with everybody here at CalUCA and everybody else that if you're not from CalUCA and you tagged along, well, you're welcome. And again, just a quick reminder to everybody that nominations open for board of directors for CalUCA, and send those in. Again, it's at info@caluca.org. The deadline is next Wednesday. So so with that, we'll say thank you and goodbye until next month, I guess, or the month after. We'll see what's going on with our schedule and stuff. And Craig, thanks again. You stay safe out there.
It was a pleasure. Thank you all.
All right, bye-bye.